Lovely. Being thrown right into it. My name is Amelie Ardilouze. It's a pleasure to be here today. I'm representing the EPIC PR partnership between CHI Global Health and the Enugu State University Teaching Hospital in Nigeria. So I will go right into things. So I hope that everyone here agrees with me when I say that children are right-bearing citizens that should be recognized and protected by the state. The SDG goals highlight the importance of protecting children from harm and violence and trafficking and abuse. And this was first stated at the UN Convention for Rights of the Child in 1989. However, in Nigeria, child abuse continues to be a significant problem where 6 out of 10 Nigerian children experience some form of abuse in their lifetime. So that means the majority of children are victims. There's a few types of abuse. There's physical violence, and half of all children would be victims of this kind of violence. Sexual violence, which affects 1 in 4 girls and 1 in 10 boys. Emotional violence or neglect affects 1 in 6 girls and 1 in 5 boys. But of all of these children, less than 5%, so a tiny minority, will get any form of help or support or even recognition that abuse is happening to them. Of note as well, about a quarter of girls undergo FGMC in Nigeria. So the aim and objective of this partnership is to improve child protection awareness, knowledge, and develop responses to child abuse in Nigeria. Our objectives are to analyze the current problem, and to address this, we're doing a 2-year retrospective review of all child abuse cases in Enugu State Teaching University Hospital. And we have started to do some healthcare worker analysis on their knowledge and understanding and recognition of child abuse in a hospital setting. We're also developing a training program which we will apply during our November trip. And this is again aimed at child abuse recognition and developing a referral system within the hospital so that all these cases get support. And our third and last objective is related to the second, but developing policy within ESTHER and referral pathways both within the hospital, outside of the hospital, and one day implementing this into law. So how do we do all of this? We start by building a partnership. And I think that this session will show that all partnerships start with a story. And I'll tell you a little bit more about ours. It starts as well with bilateral visits. So meeting your partners. Who are you? Who do you stand for? What is your understanding of the issue? And how do you do things where you are? We're developing training modules. So as mentioned, we're looking to teach and upskill people who already have some knowledge, but maybe not the depth of knowledge that we have. And so sharing our knowledge to bring up the local capacity is kind of what we're aiming to do with this aspect. We're interviewing healthcare workers and, as mentioned before, the retrospective case analysis. So our story started in 2019 when another CHI Global Health project went to Enugu, Nigeria, and they were teaching the local healthcare workers about child resuscitation and the medical side of sick children. As part of their program, they had a safeguarding component, which was a 1-hour session, mostly lecture-based. And all of the participants said that this specific aspect of the program was the most impactful and the one that they took the most from. Our director, Dr. IGHNx, was approached by our Nigerian partner, Dr. Uchenna Ekwochi, and they decided that addressing child safeguarding is a vital need and that there is a significant gap to be filled here. So we started meeting in 2021, COVID had a bit of an impact on our timing of things. By 2022, we had outlined our objectives and the goals of the partnership. We were awarded an ESTHER Ireland New Partnership Grant, and thank you very much, ESTHER, for that. We did our bilateral visits in 2023, and this year we are signing the MOU, we're developing our training material, and we're planning this trip in November. So the bilateral visits from last year, our Nigerian colleagues visited Ireland in June, and the goal of this was to show them how Ireland protects children. They met with various management and stakeholders we went to Ireland first. We met their management stakeholders and government NGOs, and just to kind of understand where they're coming from, what is already in place, and what is everyone's general understanding of child protection and policies there. We did a very quick one-day workshop, and this ignited a lot of passion and involvement within the healthcare workers who were attending, and sparked a lot of discussion both within the healthcare workers, but also with us. And we conducted some preliminary interviews. And then our Nigerian partners came to see us, and they visited TUSLA, the various CHI sites, the Gardaí, and various child sexual abuse units. And this gave both partners an understanding of where the other was coming from and what barriers would be towards implementation, and just develop a greater understanding between us. So our November trip, we are planning a 2-week trip in November that is sponsored by Emirates and the Children's Health Foundation. During the first week, we are going to be doing our level 2 training, and we skip directly to level 2 because we are planning on doing a level 1 online module, similar to Children's First for the healthcare workers in the room. But this would give everyone working in a hospital a basic understanding of what is child abuse and how to recognize it. And this level 2 would be to train our champions of child protection a little bit more in depth. We will also be doing a level 3, or a train the trainer, so that we don't have to keep going back to train local healthcare practitioners. During our second week, we're hoping to increase the connection in the network that we've already built outside of our hospital. So working with NGOs who specialize in sex trafficking or rape specifically, or victims of torture, and kind of bringing everyone together to create a well-functioning child protection staff and policy, and so that everyone knows what everyone else is doing, increasing record keeping and information sharing where relevant, and just developing more relationships between all of these different partners. We're hoping to develop a policy in our partner hospital, and we are hoping to, at some point, go and do some community outreach so that we can talk to elders and religious groups who have a huge influence when it comes to protecting children. So I hope that I think all of the talks today will focus a lot on capacity building and sustainability. So giving, knowledge to build up from, and then with the goal of removing ourselves from these projects, I think should be the goal of any partnership. We hope to do that by identifying and training champions, involving stakeholders both inside and outside Enugu State University Teaching Hospital, such as the Nigerian Police, the Minister of Justice, the Ministry of Children, Gender Affairs and Social Development, NAPTIF, Tamarsarc, and UNICEF. We're hoping to encourage the setting up of a child safeguarding hospital committee so that they can decide how best to move forward with our initiative. We hope to streamline the referral pathway for victims of child abuse, from the identification of abuse to the treatment and the supporting of victims, and then to the prosecution of the culprit. We hope to participate in the creation of a statewide and regional framework to protect children. So what have we learned in terms of our partnership is that partnerships can be very powerful. They are the foundation of pretty much all of the work we do here in global health. Choosing your team carefully in being mindful of who you are working with, both in terms of their experience, in terms of what they can do, their influence as well within the community. All of these things come into play when you are building a partnership. Having a collaborative approach so that everyone understands where everyone else is coming from, and moving away from the colonialism that has ingrained global health from the beginning. So moving away from that and giving power to the people that we are helping, hopefully. And conducting a thorough needs assessment from the beginning so as to not, again, bring our Western or global North views into the things that we are doing. That concludes my talk. And I am shamelessly adding our QR code here because we are a fundraising-based partnership at the moment. So if anyone feels generous and so inclined, we would appreciate any contribution. And we're taking questions afterwards. Is that correct? So that's it. I'm also contactable.